Today, what I would like to talk about is the significance of the Epstein-Barr virus and the autoimmune diseases that it causes. Increasingly more research articles are coming out and saying the lupus, systemic lupus erythematosus, the multiple sclerosis, even rheumatoid arthritis to some extent, chronic fatigue, fibromyalgia, more, more than that, several other autoimmune diseases and chronic diseases are tied to this Epstein-Barr virus. Most of us know that as the kissing disease from high school, and most people get the sore throat, and then they come over it in a few days and it goes away, and there are no future problems with that. The immune system keeps it in check. There are people with a certain genetic composition that once they get that Epstein-Barr virus, it will, in years' time, develop into an autoimmune disease. So the few examples that I mentioned, multiple sclerosis, lupus, chronic fatigue fibromyalgia, are important to me. 25 years ago, I got the chronic fatigue fibromyalgia, and I was surprised. I didn't know it had anything to do with the Epstein-Barr virus. So I started checking my blood. I was already a doctor. I had a clinic, and I tried my best to figure out why am I having chronic fatigue fibromyalgia. I didn't find an answer. Everything looked pretty okay. I didn't check for the Epstein-Barr. I knew I had it 2 months prior to that, but I didn't connect the two. But now more and more research coming out from Stanford University, Cleveland Clinic, VA system, saying that most of these autoimmune diseases are caused by the Epstein-Barr virus as a chronic infection in the body. And they know how it does it. It goes to um, certain DNA parts, and people who have predisposition to uh, get that disease will get it because of their genetics. Sometimes it runs in families. We see that. And then it can become pretty significant. Some people develop lupus nephritis. They can have their kidney fail. Multiple sclerosis goes to the nervous system, and that same virus actually acts different in different genetic groups. So people had the same Epstein-Barr virus, but then they develop rheumatoid, they develop chronic fatigue, lupus, multiple sclerosis. And so, okay, we know that, but my issue with that is then we need to start doing testing. So people who have these diagnoses of autoimmune diseases, then they have to go and say to their primary care doctor, I need to get tested for the Epstein-Barr virus panel. And that panel usually comes back positive for the old IgG antibody, which is the nuclear antigen antibody. And so when we read the research articles online, we find that EBNA and EBNA2 are the ones that are most commonly found in the lupus patients and the multiple sclerosis. Needs to get tested. So people need to go to their primary care doctor and say, I want the Epstein-Barr virus tested. Why is it? So 25 years ago, I had this Epstein-Barr virus. 2 months later, not connecting the two, I started developing chronic fatigue fibromyalgia. I'm hurting here, I'm hurting there. It's moving to all different kinds of places. I have migraine headache. I cannot sleep. It doesn't matter. I'm so tired. I still cannot sleep. Sleep a few hours, wake up tired. And having irritable bowel syndromes, having food allergies that I never had before. And so it's hard to put your fingers on when you have all those different kinds of diagnoses and say, what's causing that? Why do I have now the irritable bowel? Why do I have to run to the bathroom 6 times, 8 times a day? And the answer is that chronic Epstein-Barr virus is a lot of times the cause. It needs to be checked and tested for. And then in my case, I was going around for 3 years, testing myself, going to other doctors. Oh, it's all in your head. We don't have anything to point our fingers on. There's no bad labs. Your x-ray is normal. And I'm like, it's not in my head. I am sick. I have the chronic fatigue fibromyalgia, all the symptoms, and something is causing it. And it was like, yeah, you're under too much stress. No, no, I'm not. I enjoy stress. It's okay. So finally, some of my patients like, can you send me to Lubbock, Texas? There's a doctor there who back then was 82 years old and just a regular cowboy. And he was a DO doctor, and he started treating my patients with the Myers cocktail, high dose vitamin C, high, not 10 gram or 20 gram, much more. They got treated, and 2 months later, they started coming back to our clinic and telling us that they got cured. And after the third or fourth one, I'm like, no, you don't get cured of chronic fatigue fibromyalgia. That's just, maybe it went away. You don't get cured. And they're all swore by it. We got cured. So I went to the doctor. I got treated. Once a week, I had to go, got the Myers cocktail, high dose vitamin C. And then in 6 weeks, all my symptoms went away. No more fatigue, no more aches, no more problems with sleeping, no depression, no migraines, no irritable bowel. What a great life, and I felt good. So there are celebrities, sometimes you wonder, you can go online, and this year we have Christina Applegate, who announced that she has the multiple sclerosis. A few years ago, a famous actress, Kelly Bundy from Married with Children, started her career, and a lot of other great movies she played in. And now for years, she has multiple sclerosis. So let's not talk about her, but I'm just trying to point out that there's a cause. There's research studies that say what creates this problem. So here's one from Stanford University, and it says, study identifies how Epstein-Barr virus triggers multiple sclerosis. So I never heard that while they were mentioning the multiple sclerosis. So there seems to be a disconnect. They talk about the multiple sclerosis, they report on it, the symptoms and all that. And then there's no follow up to say, hey, wait a minute, research tells us this is what's causing it. And can we do something about it? Can we get treated in a regular IV clinic like what we have? My wife and I have a IV clinic here in Chandler, which is the outskirt of Phoenix, Arizona. And we still get um, people who come in and they never heard of the Epstein-Barr virus for autoimmune diseases. So we have to educate them. We have a lot of articles, a lot of medical research, show it to them. And so I'm putting out this video just to bring attention to the fact that medical research knows that most of the cases of these autoimmune diseases are caused by Epstein-Barr virus, a chronic viral infection. And yes, your doctor might diagnose you, but may not have an answer to cure it. Some of the medications we have available suppress the symptoms of autoimmune flare and makes you feel better. But so far, they have not found one medication that would kill the virus and potentially cure the disease. So We're trying to put this message out and say, if you have any of those autoimmune diseases, go read the medical literature, but go to your doctor and be tested. And then there's an answer. If it's not the Myers cocktail or high dose vitamin C, then you can make changes in your diet, in your lifestyle, eliminate certain things that promote viral growth, and then get cured and feel good, live your life. So that's our message for today.